share with you guys some of the ideas that they presented, but the three of you are all in the SHCIP project, so I'll skim over some of the SHCIP specific things. And Carrie and Tilly are down at Mesa Middle School and the other Roswell schools, and Crystal is a new provider up at Carlos Vigil Middle School up in Espanola. And so I think you guys probably have not met up to this point, but you'll be seeing a lot of each other in the SHCIP project. And I'm Nancy Vandenberg. I'm the Youth Engagement Specialist for the SHCIP project here at Envision, New Mexico. And my email's here on the slide. I think you guys probably all have it, but just wanted to repeat it in case you have questions or follow-up from this webinar. And you see on this slide that if you guys want CMEs for today, just make sure you stay on the end until the end and say your name again so that we can make sure you get those. And here's our official disclosure statement. I don't have any commercial interests or financial relationships to disclose. So just a couple of questions to think about. I'm going to do sort of a didactic presentation for 20 or 30 minutes and then open up the floor for you guys to share ideas or questions or challenges. But as we're going along and I'm presenting, here's some of the guiding questions I wanted to ask you guys to think about. One, how do you engage youth at your school-based health center now? Two, how would you apply the information that we talk about today in your setting going forward? And three, what overall challenges exist in your school-based health center now that you feel like you might be able to address using youth engagement? We know you're very busy, you're very focused on providing clinical care to your students. So to the degree possible, rather than youth engagement being a new set of tasks, we want it to be a useful tool to address tasks that are already on your to-do list. So be thinking about that as we go along. So I'm sure you guys know what SHCIP is. It's the School-Based Health Center Improvement Project. It's a CHIPRA-funded federal grant to demonstrate the things that can be done in school-based health centers as a model of delivery, especially through quality improvement. And we have quite a few goals, but one of them is specifically around youth engagement. Our goal is that participating school-based health centers will implement strategies to effectively engage youth as partners in advancing their health literacy. And there are a couple of objectives under that goal, but one of them is that by August 2014, 90% of participating school-based health centers will employ site-specific youth engagement strategies to improve their students' health literacy. Do we have a new member joining us?
Yes, it's Jacqueline in Colorado.
Oh, hi, Jacqueline.
Project. Hi.
So Jacqueline, we have, in addition to myself and Kevin here at Envision, we have three other members of the webinar, all of whom work here in New Mexico at school-based health centers on the SHCIP project. And just so you guys know, Jacqueline is my counterpart in Colorado, which are working on these same grant objectives that I was just discussing. Okay, so that is what the grant details, and we feel like this is a good goal for the school-based health centers in this project, but school-based health centers overall, especially since the Affordable Care Act is requiring that people move towards a patient-centered medical home. The patients in your cases are young people, so if you're having engaged patients, you're having engaged youth. So we feel like this is critical as we move forward with healthcare in our country. So when we started this grant, we decided we needed some guiding definitions when we talked about positive youth development and youth engagement. And we feel like positive youth development is the overarching concept, if you will, and youth engagement is a practice within that concept. So for our purposes, we have adopted a definition of positive youth development that is in an article that we have actually shared with you guys. You should have a binder and a flash drive at your sites. And there is an article, just a real short two-pager called Positive Youth Development is a Public Health Approach. And they use a very similar definition of positive youth development, which is that it's the deliberate evidence-based public health strategy of providing support, relationships, experiences, resources, and opportunities that promote positive outcomes for young people. And then we see youth engagement as a practice by which you can contribute to positive youth development of the young people you work with. And we looked at, I would say 10 to 12 different definitions in the field of youth engagement and cobbled together the parts that we felt like most fit this project, healthcare in general. So for our grants purposes, we're saying that youth engagement is the intentional, meaningful, and sustained involvement of young people in the programs, practices, and policies that seek to impact them. In partnership with adults, engaged youth develop the capacity and confidence to participate as productive partners in the decisions affecting them individually and collectively. So those are the concepts we're working from and the objective that we're working towards. So for a lot of school-based health centers, youth engagement may be something that naturally happens, but as a sort of a theoretical principle, it's new. And so we wanted to share a tool that's used in this field a good deal, and it's Roger Hart's Ladder of Young People's Participation. And back in the late 80s and early 90s, Hart came up with this concept and has 8 rungs on this ladder. Hopefully you can see that visual relatively clear. And I think one of the reasons we wanted to share this with you guys is because if you are new to youth engagement, you might be starting out at one of the lower rungs, but we wanted you to see the whole realm of possibilities of youth engagement. And from Hart's perspective, the first 3 rungs are what I would consider youth engagement done wrong, but really he shows them as non-participation, with young people either being manipulated, brought in as tokens or decoration, and that happens sometimes, but where we really want to see people start is at rung 4, where young people are assigned and informed. And I would think that all school-based health centers are at least here, and probably further up on the ladder. But this is a tool you guys can use to look at your practice and think, are you starting it at 4 and do you want to move to 8? Are there a couple of rungs where you want to do small parts of those? What does your practice allow for? And that sort of thing. So we're hoping this will be a useful tool for you to think through what you do around youth engagement. So youth engagement looks different depending on what the field is that's utilizing it as a concept. So we wanted to share with you some of what we feel like it can look like in school-based health centers. Some of these are our own ideas, and some of these are things that school-based health centers in New Mexico and Colorado have shared with us as effective things they're doing. So let me just run through this list of examples. And this is actually, the first bullet, Crystal, will be of particular interest to you because the first half of it refers to Espanola. Espanola and Carlos Vigil school-based health centers are part of El Centro Family Health, which is a federally qualified health center. And federally qualified health centers are required to have a board that has members of the community participate. And El Centro has always done a good job of having youth participation on that board. And at present, they have a young person who's on that board of their agency and is also a high school student at Espanola High. So they're working to bring her on board to promote the school-based health center, be an ambassador for it, as well as sitting on the board of their agency. Additionally, some school-based health centers have an advisory group just for their clinic. And that requires staff capacity to manage but if you have the capacity, there are sites that have found that to be very useful. And I know in Colorado, there is at least one of the SHCIP sites that does have an advisory group along those lines. Another way you can see youth engagement on the ground in school-based health centers is more individual. And we're going to talk a little bit later about individual engagement versus collective or group engagement. But as an individual provider or staff person at a school-based health center, we believe you can work to help grow students as advocates for their own health and well-being, rather than them being a silent participant in their health care, really becoming an activated and engaged partner in planning for their own health and well-being with you guys as providers. Moving on to our third bullet, We have heard of examples and think it's a great example of students being asked by school-based health center staff to tour the school-based health center to make sure the environment is youth-friendly. And I've seen that or heard of that occurring on a whole range. Simple changes like students telling the school-based health center staff that this poster or that poster could be hung in a different location or isn't teen friendly and maybe another one would be a different option, all the way up to sites asking a group of youth to tour and make recommendations and including those recommendations in a HRSA grant that would actually change the physical layout of the clinic. And I wanted to just quickly tell you about a tool that I have and that you can Google that the CDC provides. They have a graphic on their website that I believe is called Teen Friendly Office Tips. And if you have the luxury of making changes to your clinic, I think that's a useful tool. And some of them are things that would be common sense, like making sure that the behavioral health room is soundproof so students feel confident that their privacy is protected and that sort of thing. Moving on, if you have students who can help you with health promotion, we have seen often students being asked to share with the providers and team at the school-based health center what they feel like the key topics are, what they're hearing from their peers and friends in terms of the risks or the illnesses that maybe would be important to address. So that's a good use of young people as partners. And actually, if you can take it to the next level, our next bullet talks about students partnering to make presentations to specific classes, the whole student body at an assembly, or even in small groups at lunch or after school. And if you can make that happen, not only are you providing high-level education to the students who'd be doing those presentations, but you'd be reaching a broader group of students who may not typically be coming to your clinic. And that brings us to the final bullet, which talks about marketing the school-based health center. Adolescents are developmentally programmed to listen to other adolescents more than they listen to us adults. So if you're trying to market your school-based health center generally or a specific service that you offer at your school-based health center, students as ambassadors for you are the best way to increase your numbers. And we've seen that over and over again. Now, I talked, when I read the definition that we're using of youth engagement, it includes a statement about youth engagement happening individually and collectively. And this was really important for us because we know that particularly the providers often do not have staff capacity to work with groups of students, but they spend a lot of time one-on-one with students, and we're confident that youth engagement can happen in that environment as well. So here are some examples of where we see and how we see that happening. Often providers are in a position to share with youth their rights in healthcare and having a dialogue with them about what are confidential services, where they can access those, what gets shared with whom, and making students aware of that and enabling them to make their own decisions around that is youth engagement. And then the two next examples are ways that you can activate students to engage with you as a provider to make healthcare decisions for themselves. And one example is the time of day for medication. So, you know, you might, particularly if you hadn't worked with an adolescent population before, you might think 8 and 8 or 6 and 6 are good times. But if a student sleeps in till noon on Saturdays and Sundays and they have to take daily medication, that might not work for them. So you're going to make the best recommendation as a provider if you're in a dialogue with the students, and then that makes them feel empowered that they have a role to choose part of their healthcare decisions. And then the next example is more about planning for wellness. You know, there's lots of students who get their exercise through school sports, but there's lots of people who don't like school sports. So if you have a dialogue with students about what kind of exercise would work for them, you're more likely to get compliance with them increasing physical activity if that's a dialogue versus a prescription. And especially for behavioral health providers, I think our next example is important. Though I know as medical providers, you guys end up, especially around smoking and drug use and sexuality, you end up having these conversations as well. But if you see that they're sexually active and not using birth control or STI protection, or they've shared with you that they want to stop smoking or something along those lines, we've heard examples from providers where they brainstormed what kind of refusal skills with the student is actually going to work, and even role played that. So if a student is nervous about telling their partner that they don't want to have sex or that they want them to wear a condom, if you have an opportunity to role play that with them, even though they might appear uncomfortable with that, they may be more likely to be able to act on that suggestion and act out that refusal skill if they've had that opportunity. And then it's a way to engage them in planning for their own health care. Our next bullet is a little bit about having that conversation with students about how they access care. And some of that is health literacy skills that they need, that they would use with you at your school-based health centers, and that they would use after they graduate at other clinics. Knowing how to make their own appointments, if you give reminder calls or reminder cards, using those. Remembering and writing down somewhere what the school-based health center hours are. And we talked with some of the sites yesterday about using Google Talk, which is a free service to text appointment reminders to students. So that's something, Kevin doesn't know this yet, but I'm going to ask him to work on that a little bit with me and see if we can figure out how that works, and maybe share that with all of you in the project to see if that's something you'd be interested in. We did have one site that was using that last year, and I think they did a combination of leaving text messages and voicemails for students about appointments, but you don't have to use your personal or even clinic cell phone to do that. There's not a return number that then students access, so it's a good way to do that without, having to use your personal phone. The other thing I wanted to mention around this idea in terms of engaging students and increasing their health literacy is about when you talk to students about the next step in their progression. You guys are working with middle school students, and I know Tilly and Carrie, you guys have high schools as well. So a lot of providers at school-based health centers have told us they start having conversations with students at about the 11th grade level in terms of where they would access care after they graduate, and are they going to college, and do they know if there's a health center on campus, or if they're going to work, do they know where the public health office is or where else Medicaid is accepted. But we're encouraging folks who work with high school students to have those conversations in earlier grades, and I think it's worth maybe even doing that in baby steps with middle school students, because sometimes school-based health centers are closed, and unfortunately here in New Mexico we have the second highest high school dropout rate in the country, and the majority of those are students who are leaving by the 10th grade. So if we can make sure those students have the information they need about accessing care in other places, I think we're really setting them up to be successful with their health care when they can't utilize the great services you guys are offering. And finally, I think providers are in a great position, and I'm including MAs and clerks when I say providers in this example, because I know all of you deal with students, and sometimes you're looking at prescriptions, recommendations for care after a student has left the exam room, and using medical terminology that students can understand, making sure they understand the terminology and the instructions they're given. And I think the American Academy of Pediatrics, and I think even the American Medical Association, is now recommending the teach-back method, where you have a student at a minimum repeat back what you've told them, but ideally have them teach you how they're going to take medication or what their steps are to achieve their healthcare goals are, so that you can make sure they really have understood. Especially when you're looking at down to the middle school age. If you have a student who respects authority and has a tendency to be compliant, or on the other end of the spectrum doesn't respect authority and maybe doesn't care what you're saying, this is a critical time to have them teach these things back to you. Moving on to collective student engagement. Hopefully some of you will have the opportunity to work with groups of young people, whether that's in group therapy, if you're doing group treatment around a shared chronic condition, or if you just have student groups that you work with on youth engagement activities. These are some things hopefully you could consider taking on board. A lot of school-based health centers we've worked with are working with young people to help improve their educational and marketing materials. So everything from the school-based health center brochure to health topic flyers. Students can really make sure your materials appeal to your clientele because they know what they like, and that's more than likely going to be what their peers like. And this can really help you with your patient-centered medical home goals as well, since making sure those marketing materials are patient-centered gets you points towards patient-centered medical home. And I mentioned already a little bit about how you can have youth look at your physical facility and suggest enhancements. And I think the one caveat I wanted to share on that is to be real transparent with them about your ability to make those changes. So you might have complete control over your physical facility in terms of taking posters up and putting them down, but you might not be able to move a wall or soundproof a room. So if you're taking on board suggestions that you want to share with your sponsor agency, but you know there's a chance those things might not be funded, make sure you're transparent with the kids about that so that they don't think that you're wasting their time because they don't see the changes made that they recommended. Going back to marketing, in addition to print materials, we do have school-based health centers who are using social media now to market services and keep patients engaged. And I just wanted to share a few tips on that. If that's something you're interested in doing at your site, I have some print materials that might be helpful. We have some recommendations from the Social Work Professional Association, and we have some other recommendations from some nonprofit agencies that could be useful to you. And what we've seen be most effective is when a staff person is the administrator, let's say of a Facebook site or a Twitter account, and the young people provide content, but that's always supervised with staff time and attention so that you can control what goes out. And that has to be an ongoing responsibility of a staff person, because if students post things as a friend of the clinic that could be offensive or bullying, you have to make sure that a staff person has time to read the content that's up on your page. So it can be a really great tool, particularly when you start looking at high school students, but it does have pitfalls that you have to plan in advance for. I know that in New Mexico, districts are required to have student health councils, and if you as a school-based health center person are participating in that, you have an opportunity to help those school health councils involve youth. They are required to have youth participants, but they're not always set up to make that successful. So if you know your patients would be good members and you can mentor them through that experience, that can be a really important role for you to play. Often those are meetings that adults don't enjoy. So young people need help. I mean, ideally, the way the meeting is run would be changed to meet the needs of the youth. But if that's not possible, to at least have an adult ally go with you to the meeting can really help students better participate and maintain engagement in those opportunities. So I just wanted to mention that as an option. Students in groups can also present issue-specific campaigns in the school, and I think a lot of our school-based health centers have done this around particular health months, National Nutrition Month, National Teen Dating Violence Awareness Month. Those are things that groups of kids can often get behind, and they have a specific focus and a finite end date. So if you don't have time to run a year-long group, but you know you have a group of students interested in a health issue, that's a way to work with them in partnership. In terms of target audience, I think it's always helpful to look for students who are interested in healthcare careers. Definitely here in New Mexico, we need as many healthcare providers as we can get. at every level. And so if there are students who have that burgeoning interest, anything we can do to get them to collaborate means they're going to be more engaged because they have a vested interest in it. You're doing something that helps our state by doing that. And it can also help you build relationships with your school and your school district, because they can help you identify those students, and then they see you providing a valuable service to their school because you're a role model in your healthcare career to their students. And finally, I wanted to mention in talking about monthly education campaigns that February is School-Based Health Center Awareness Month. And it took them a while, but the National Assembly on School-Based Healthcare finally has some resources up on their webpage. So if you're interested in doing an open house or some other event to recognize School-Based Health Center Awareness Month in the next couple of weeks, there are really good resources up there. There's some letters to the editor, there's invitations to elected officials, and some things that you can use as templates for doing events on your campuses. And Crystal, for you in particular, I think if you guys have the capacity to do something, since you're going to be the new head medical provider at Carlos V. Hill, this might be an excuse to introduce you to the broad campus, as well as recognize School-Based Health Center Awareness Month. So it might be something to consider doing there at your middle school.
Sure.
The next thing I wanted to share with you guys are some tools and resources. I mean, this is a pretty brief webinar, but there's all kinds of wonderful information on the internet. Everything from just some policy and more field research stuff on the youth engagement and health literacy fields, but also activities that you can use with young people. So I wanted to share a few of these so you don't feel overwhelmed by the broad list of things that are available on the internet. And you'll have this if you pull down the PowerPoint and print it to look at your leisure. But I wanted to show you a couple of them. The first one, youthhealthlink.org, is actually a New Mexico based website, though it can be useful for everybody. So Jacqueline, you're welcome to share it with Colorado sites. It's co-sponsored by the New Mexico Forum for Youth and Community and Department of Health, OSA. And there's all kinds of useful tools on here. There's fact sheets about different health topics if students wanted to do outreach. But the one tool I wanted to show you in particular is this far left-hand tab calendar. If you do have young people, or if you yourself want to do outreach on monthly topics, this calendar is a real useful tool. So for example, February is not only School-Based Health Center Awareness Month, it's Teen Dating Violence Awareness Month. It's also Oral Health Month. So there's always topics every month that are health related, and this is a good place to look those up. Looking back at the PowerPoint, a good deal of the rest of these here in the middle are specifically about engaging young people. So they'll have tools and techniques about, for example, Youth on Board, how to make boards of agencies a good place for youth to participate. This workbook has lots of activities and worksheets that help you with that. And then the final, oh, actually, let me go back to findyouthInfo.gov and show you that real quick. The websites I've included, just to make sure they're good, accurate sites, are mostly government sites. And I think this is a really good one for you guys as adults, but then also you can show young people this site, and especially for older youth, it's kind of in the middle. It's good for adults and good for kids. So there's topics all across the top. Everything from if students want to do fundraising to if they want to hear what other young people have to say, or if they want to look at specific topics like youth violence, substance abuse, LGBT issues, and so forth. I think this is a really great resource. And then the last listed resource here, I wanted to point out, it is the National Assembly's toolkit that they've put together on youth engagement, and it's very specifically targeted to school-based health centers. And we actually put a copy of this toolkit in your binders for those in the SHCIP grant. It's a pretty lengthy toolkit, so I wouldn't expect you to read the entire thing, but they have broken it down in really readable clumps. So there's some squares throughout the document with what school-based health centers around the country have done. So you might just pick it up and browse it and look through some of those activities that they have engaged youth with. And they also, in that toolkit, share some templates of things like invitations to elected officials to come visit the school-based health center. So I think it's a real good resource. And if for some reason you don't have access to that binder we provided, this is the website where you can access it. Moving on, the second list of tools and resources that I wanted to share are more targeted to health issues and health literacy versus youth engagement broadly. And the first one here and the last two are really more targeted for adults, but all the ones in the middle are sites that you could recommend to young people to look up health and health literacy information. Now, if we want to go look at the CDC website, they have, the CDC website in general is a great resource, but they have this specific section on health literacy. They have all kinds of really useful tools on how to develop materials to address health literacy, how to make sure your materials aren't at a reading level that's too high for your population. And they also try to keep track of activities that are going on in the different states around health literacy. So if you look at this spotlight section of the website that I'm circling right now, there are some really good materials that they just recently put up about making your language plain. So those are things you could look at if you were going to, for example, revise your brochure or any of the health topic information you'd be passing out to young people to make sure it's easily understandable. The next one that I wanted to point out is specifically, and let me go back here, for young people. And if you're working with middle school students, I think it really kind of depends on their maturity level. They have this tab that's specifically aimed at teenagers. But if you have a sixth grader, some of the tab for kids might be more appropriate. So you'll just have to probably gauge their maturity. But they have informational things on all these topics, and they have activities as well. So it might be something that's worth you browsing if you wanted to do some activities with young people around a specific topic. And then if you're going to work with their parents, there's also a tab for parents. So here's the kids tab, and as you can see, it's just, even the graphics are a little bit younger, but it does have little quizzes. Sometimes there's coloring sheets on here. There's a dictionary of terminology on both pages, which I think is really helpful. And most of the ones I've listed, again, here in the middle are government or university sites, so you can feel confident recommending those to young people. And I think, I'm trying to remember which one. There's one on here if you do have students interested in healthcare careers. I think it might be bam.gov. That is a good website to share with them because I think it's aimed, it may not be written out that way, but I think it's aimed at getting young people interested in healthcare careers. And then the two final bullets I just wanted to share briefly. The very last one I think has some good tools. It's the AAP's site that addresses health literacy and how they're trying to approach health literacy in a pediatric practice. I think that one is particularly helpful because when you do a general search on health literacy, a lot of times what you find is hospitals and practices that are dealing with adults who have low reading literacy. And that can be useful too because it can help you make your reading materials at an appropriate grade level. But this page talks specifically about increasing health literacy of pediatric patients. So I think it's a good tool. And then the next to the last bullet, I just wanted to mention briefly that I know you guys are often probably already, and if you do any additional youth engagement, that will probably grow your task of trying to do some media literacy with young people. And there's some good resources there because young people often are not trained unless they're lucky enough to have a library science class on how to differentiate what is good on the web and what is bad on the web and what is accurate and what is inaccurate. So I think oftentimes healthcare providers are asked to help patients sort through that. So that there's a media literacy website there that if you do end up in that position, it can be a good resource. Do we have someone? I heard a chime. Do we have someone new joining us? Or someone?
It looked like somebody dropped off and came back.
Okay,
yeah.
Great.
If anybody did jump on, though, please let me know so we can add you to the list.
And if you did, it's perfect timing because now I promise I'm not going to stop talking. I will talk less now because we really want to hear from you guys. Any ideas that you can share with one another and with us about what you've done already to engage youth. Any challenges in your practice that you've found youth engagement to be helpful with, or any questions you have for me or for each other about doing youth engagement.
Hey, Nancy, this is Crystal Longiano. Can you hear me?
Yes.
Okay. I'm having a little trouble with the phone, but I think everything that you addressed, we have definitely implemented in our school base, and I just came aboard just a month ago, and they had already had some things that have been working as far as touring the clinic and just making a really homely environment for teenagers. With posters on the wall. One of the barriers that we're dealing with right now is when we call the kids out of class, a lot of the teachers are complaining that they're staying out too long or that they're not giving their school excuses. They don't turn them in, so they get marked absent. So we've had a lot of kiddos that have been marked absent for the whole year. They have like 23 absences because since August they've been coming in every month and not turning in their school excuses. So we've been working with the front desk, the front office secretaries, and we've gained access. They allowed us to gain access to the school repository of marking them absent or present. So that way our secretary that works at our clinic can look and see if they're actually in class, and then if they get marked absent, she can call and notify and let them know that they were actually in the clinic. So that's one of the barriers we're trying to work around right now is just the teachers have this rift with them, kids being always called out. So I don't know if anybody else has suggestions about that, but we really do try and work in either early morning hours, or we have them come after school, or just classes that, they're caught up in, they don't have testing going on. We try and work with the student schedule.
Well, I'd be interested to... Yeah, Carrie, go ahead. I'll be interested to hear how you guys deal with that at Mesa.
We were actually blocked out of Power School and being able to check their schedules once all the HIPAA and FERPA stuff came about. We used to have access to that, but we no longer do. But what we do, and I really haven't heard complaints about from the teachers, is on their note to go back to class, we put what time. That if they leave here at 10 o'clock, they should be in class by 10:05, and we haven't had a problem really with that.
Is that something that would help you guys, Crystal, or what does the paperwork look like?
I think it's we send them the school excuse or the note back to class with the time listed that they're here. The student isn't turning them in, though. So we reiterate that it's important. But I guess between the transition from coming to the clinic, leaving the clinic, and then getting back into class, they just forget that they need to turn the excuse into the teacher, or they just get caught up with just their friends, and they just forget to turn it in. So we're making it a little more of a point that when we have them leave and we say, you need to hold this in your hand and give it to your teacher when you get back to class. We also have we've had to make our own school excuses just because the funding was low. So we have them on this little flimsy paper, and we might just implement something a little bit bigger or something that the student won't. It's kind of like a receipt when you go to the grocery store. Sometimes you just forget where you put your receipt. Same thing. It's the same concept. It's so small they can lose it easily. I can see how that can happen. So that's our barrier. The problem we're having is they just forget. They forget to give it to the teacher, and then they get marked absent. So,
right.
but yeah, we're working.
I mean, first of all, I want to compliment you guys, Crystal, because I think the one thing that may be invisible to you is that you guys do have this relationship with the school, the front office and administration. There are lots of school-based health centers that the school would not dream, never mind HIPAA and FERPA, but just because they don't have a good relationship with them, they would not dream of letting them access that database. So you guys are ahead of the game in that sense. I mean, that doesn't necessarily, I mean, that helps to some degree with this challenge, but I know it doesn't wipe it out. I think one thing you might think about, and think about it and then email me if you want this. We have a surplus of these postcards that the Department of Health produced several years ago, and some of them talk about behavioral health, some of them talk about sports physicals, and they're literally postcard size so that you can mail them, and they have pictures on one side and then they're blank on the other side. And I mailed a bunch to one school-based health center so they could use them as appointment reminders. But if you guys wanted a bunch of them, they're hard card stock. So, and they look definitely different than a receipt. So if you guys wanted a bunch of those and wanted to try handwriting on them and using them, I would be happy to send those to you.
Sure, yeah, I'll email you about that, and we can set that up.
Ingrid may be familiar with them, so ask her if she knows what I'm talking about. There may be some floating around there already.
Okay, I'll ask her.
I think that's a great idea, Nancy, because that advertises the school-based health center more, and we also have a surplus of those, and we can never seem to get rid of them.
They did work with young people to make those, but that young people don't love them. I have to say, I think it's something to do with the color scheme. They're kind of this weird ochre color, and I don't think they were as popular as had been anticipated, but you know, if it's free, even if it's not the most attractive option, it's better than having to buy your own paper and make them.
Right. And we spend hours with the cutting machine, and so it would help. It would really help us.
Yeah. Okay. Well, I'll look around and make sure we still have those, and check with Ingrid and see if it seems like a good tool for you guys. The other thing I was going to suggest, just in terms of rebuilding the relationships with the teacher, is especially if you guys are looking at having an open house anyway, try to do some sort of teacher appreciation component of that. If you can get with Cindy and see if there's a budget to buy 50 breakfast burritos, have them come over before school starts, give them a school-based health center brochure, let them know that you're working on this issue, and give them a breakfast burrito. I mean, you would be amazed how a $60 investment like that just works wonders.
Yeah, that's a really good idea.
Bribery is not to be sneezed at.
No.
Any other ideas or challenges that you guys are facing that are related to this topic?
Well, Nancy, this is Jacqueline. Can I just add something to the idea of the integrating teachers?
Sure.
In Colorado, one of our sites has a very similar dilemma. So once a quarter, they go into the teacher and staff meetings and just do a myth-busting session. So really talking about what do school-based health centers provide, what services are there. Let's just have an honest, open, candid conversation and address the concerns of, are young people missing too many classes? Is there a way we could rotate it so it's not always the same class that young people are being pulled out of? Things like that. And just having that consistent presence and conversation has seemed to help that particular site. So that's another idea as well, in addition to the bribery.
Thank you for sharing that, Jacqueline. I think that's a great idea. And that would be a good time. I forget now if it's NASBEC. I'll have to look up a resource and maybe if I can find it, share it with you guys. There's a one-page brief that talks about how students who use school-based health centers are healthier, and as a result they miss fewer classes. And I think that would be, you know, you don't want to just give it to somebody in a vacuum, because then they may just feel like it's propaganda. But if you were to go to a meeting or something like that where you're trying to create goodwill and you could share some of that data with them, that can be real compelling, because no teacher is, you know, they have objectives they're trying to meet too. So in the moment, it's annoying if your student is not there and you see them getting behind. But if you think of the whole year and how many more days they'd miss if they didn't have access to that, you know, that's the big picture they need to understand. So if I can find that, we'll either post that on our website or send it out to you guys.
Okay.
And speaking of which, the one of the things I wanted to share with you guys, I'm going to pull up the Envision website real quick and show you a sort of a work in progress here. If you go to our Envision website, which I know you know how to do because you went to the calendar to sign up for the webinar, but if you go down here to Tools and Resources, we redesigned our website, and now under each program we're going to have different resources. And as you can see, they're kind of thin on the ground. For CHIPRA, we just have the Zoho tools and the bullying prevention flyer that we put together in the fall, but this is going to be growing over the next semester. So we're lucky enough to hire some student employees who are working on some resource sheets. So they're going to do one on fitness, one on nutrition, and I think because of the conversation we had with you guys at Mesa, we're going to have one on growth and development, some of those books we talked about that are good for kids to think about physical development. And so maybe we should also start including some things like those briefs that I mentioned that you can print off and share with your school administration. But keep your eye on this. We're going to be trying to add stuff on a regular basis in this area. I know you guys all have a lot of free time to just randomly visit websites, so we'll also try to keep you posted, but if you have a spare moment here and there, definitely check it out. Any other activities that you'd care to share or challenges you need help with? One thing that, well, two things I wanted to mention that came up on yesterday's webinar from other sites that I think might be helpful to you. One, OSA has a brochure about the laws in New Mexico around confidential sexual health services. And they still have some of those if you either don't have them at all or need them in terms of at what age they can have those confidential visits. So I think that's a good youth engagement and health literacy tool that I wanted to mention. So you can ask OSA for additional copies of that, because privacy seems to come up a lot for school-based health centers. Students are very concerned about it, and it can keep them from coming if they're too concerned. So that's a tool that is available through OSA. And the other thing that came up... I'm sorry?
Do you have those, or do we contact OSA to get those?
Contact OSA to get those, but do you know the one I mean? I have one scanned just so I can remember what it looks like. Do you want me to send that to you?
Yeah, that'd be great. That would be great.
I'll send brochure, and it's really colorful and youth friendly. They had focus groups of young people that helped them create it. So it drives me crazy. I don't like it because I think there's too much color and stuff on there, but that's exactly why teenagers like it. So I'll send you guys the scanned version of that. And they have just a generic DOH number on the back if you have questions, but you could just email Jim Farmer or Tessa or Nancy Kirkpatrick to order those. The other thing that we talked with another middle school a little bit about, a provider was sharing the concern that she really does want to focus on that individual engagement because she doesn't or isn't allowed a lot of time with students in group settings. And she had seen a professor and doctor here at UNM made a box for providers to use in their exam rooms of tips and tools and terminology to share with young people, specifically around lifestyle change and nutrition through an obesity project that was done. So we're going to try to get our hands on that, because we have talked with providers who said that they'd love to have like a little index box in their exam rooms where they could just pull out an index card and share a new term, a new fact with young people to increase their health literacy. Even if it was different than the topic they came to the school-based health center to address. So we've been thinking about whether we could produce or help produce with you guys something like that. And then we found yesterday that there may be one already created specifically about lifestyle change and nutrition. So we're going to be looking into that, and if we're able to do something along those lines, we will let you know. And in the meantime, if you have topics, facts, tips that you know you're already having to review with students, please do let me know, because then we can make sure we incorporate that. I mean, I think I wouldn't even looked up those books about physical development, Carrie, if you hadn't mentioned that that's something you really feel like is an area of growth for kids. So we love to hear what's going on in your practices, so we know where we can provide support. Okay, do you guys have any final questions or suggestions before we come to a close?
One thing we're doing this week, Nancy, is talking with the health classes.
Oh, great.
Can you hear me?
Yes, sorry I interrupted. Go ahead.
Okay. You know, all the freshmen take health classes. So we are going into each class and telling them a little about the school-based health center, and then bringing them out here for a quick tour. So that way they physically know where it is, and they've heard a little about what we can do for them.
That's great. I think that, you know, teenagers can appear to be so bold, but they are so frightened on the inside a lot of times, and I think we forget that. And so seeing your actual face, who you are, and seeing the physical facility so they don't have to look stupid, that is just, that helps so much, I would imagine. So I bet that'll be great.
I'm hoping it will, and we can do this every year as all, you know, they all have to go through health, the health class.
Right. Well, and you know, you might check out that NASBIC website to see if there's anything they have for School-Based Health Center Awareness Month that you guys could use. I haven't looked in depth. They just came out with it this week. I don't know if you guys are signed up for their emails. You may have seen the email with the links. I clicked over to the page, but I haven't looked at the specific tools yet. But you might find something there that's helpful that you could pass out to the students or give to all the health teachers, something along those lines. So maybe that'll be helpful in your plans.
Mm-hmm. Yeah, we do have something planned for Mason Middle School for School-Based Healthcare Month. We just haven't got into what we're going to do for the high schools yet.
Great, great. Yeah, I think sometimes it seems daunting to plan a special event, but even a simple thing can go a long way. So anything that I hear that anybody else is doing, I'll definitely share. I mean, I've seen people do everything from make a video and show it on the school, if school has like a broadcast channel, to just having an open house with hot chocolate and after school and letting anybody come in and have hot chocolate and get a tour if they want. So I think depending on how much time you guys have, it can be anything, and anything is better than nothing. So let me know if there's anything we can do on our end to help.
Great, thanks.
And actually, that's the last thing I want to say. You know, I love this topic. I love talking about it. So anytime, feel free to contact me if you have questions or if you need resources. If I don't have them, I can at least try to find them somewhere else. And Jacqueline is another great resource. So she's doing the same work in Colorado. So if I don't know, I can call Jacqueline and try to get resources and ideas. So this is an important part of this grant, and we want to be here to support you. So let us know as we go along if there's anything we can do. And with that, You're welcome. I think with that, we'll bring it to a close. And it sounds like we still have Carrie, Tilly, and Crystal and Jacqueline on board. Was there anyone else who joined us? Okay, great. Well, thank you guys so much. I appreciate your time today, and we will see and talk to you soon.
Okay, bye-bye.
Bye.
Thanks. Bye-bye.
Bye, Nancy. Thank you.